And good evening to everyone. Thank you for joining us for yet another press briefing as we continue in our fight against COVID-19. Let me recognize the presence of the Minister for Health, Wellness and New Health Investment, Dr. Irving McIntyre, the Permanent Secretary in the Ministry of Health, Letitia Lestrade-Wyke, the National Epidemiologist, Dr. Shaluddin Ahmed, the Director of Primary Healthcare, Dr. Laura Esprit, the medical internist at the Dominica China Friendship Hospital, Dr. Portia Mead. Also with us, the Deputy Chief of Police, Lincoln Corbett. We also welcome amongst us the media, and to all those tuned in, once again, good evening. Our fight continues against the spread of COVID-19. The Ministry of Health, and by extension, the government of Dominica, has put several measures in place to safeguard public health. We have once again convened this press briefing to provide the general public with the necessary information so that each individual can make informed decisions to protect themselves and their family. With every press briefing, we begin by laying the foundation, and that's where Dr. Shaluddin Ahmed, the national epidemiologist, comes in, and he will do the first presentation.
Thank you, Ms. Harry. Honorable Minister of Health, Dr. Irving McIntyre, Permanent Secretary, Mrs. Letitia Lestrade-Wyke, Dr. Portia Mead, Consultant Internist, Dr. Laura Esprit, Director of Primary Healthcare, Mr. Lincoln Corbett, Deputy Chief of Police. Pleasant evening to everyone. As of today, the total confirmed cases of COVID-19 are 14. That is, 2 additional cases have been confirmed since our last press briefing. Thankfully, these 2 cases are the contacts of the index case number 3. These 2 cases are asymptomatic, and they have been admitted to the COVID complex in Portsmouth. With regards to the total number of confirmed cases, 9 are male, 5 are female. Their age ranges from 34 years to 85 years. The median age is 55 years. 5 of these patients have chronic conditions, but it is important to note that all of these patients are currently clinically stable. There have been no deaths related to COVID-19. Also, contact tracing is ongoing. So far, 37 contacts have been traced. Of these 37, 36 samples have been tested, and 1 is pending. And of these 36 contacts, 11 are positive, and 25 contacts are negative. Additionally, 34 contacts have been traced, and 25 were tested, and they are all negative. As of today, a total of 255 PCR tests have been completed. Of these 255, 241 are negative. For the month of March, a total of 500 asymptomatic Dominican returnees have been quarantined. Of these, 315 were placed on home quarantine, and 185 were quarantined at the government quarantine facility in Portsmouth. The government quarantine facility is currently housing 119 persons. So now, in conclusion, I want to assure you that our efforts, our Ministry of Health efforts to contain the spread of disease is relentless. I'm asking everyone to wear face mask anytime you need to go out in public. Continue to practice social distancing and good hand hygiene, and all these efforts will help to prevent the spread of COVID-19. With this, I thank you, and good night.
And our thanks, as always, to Dr. Ahmed. Our next presentation will be done by Dr. Portia Mead, who works very closely with Dr. Ruby Blanc at the Dominica China Friendship Hospital. And Dr. Mead will present this evening on the protocols that continue to be implemented at the hospital for our own protection.
Good evening, everyone. Good evening to all of our listeners. Protocol has already been established, so I'm just going to go into what we are currently doing at the hospital right now. So currently, we have 2 screening areas at the hospital. There is the main screening area, which is the first area that patients will enter the hospital. Everyone who enters this first gate will be screened. This includes patients seeking medical attention as well as hospital staff. In this first area, simple questions will be asked. Questions such as, have you in the last few days had fever? Have you been into contact with anyone who has recently traveled or who has flu-like symptoms? If the answer is no, and you do not have any fever, then you proceed to the accident and emergency department. However, if the answer is yes, you are then directed to the respiratory screening site. There, the patients who meet the case definition will undergo upper respiratory tract sampling, meaning a nose swab and a throat swab will be taken. All of the patients in the isolation unit who are confirmed with the COVID-19 disease are presently stable and improving gradually. None has required any mechanical ventilation. So at this moment, we'd like to thank the public for cooperating with us at these screening sites. We would like to implore your continued cooperation. We thank all Dominicans for assisting us as we strive to flatten the curve and to put an end to this dreaded disease, as we continue with our social distancing, hand hygiene, and cough etiquette. Thank you.
Thank you very much, Dr. Portia Mead, who again is the medical internist at the Dominica China Friendship Hospital. Dr. Laura Esprit has been with us before, and she and her team continue to work diligently in the fall when it comes to the contact tracing. So she's our next presenter for this evening, Dr. Laura Esprit, the Director of Primary Healthcare.
To the Honorable Minister for Health, the Permanent Secretary for Health, our National Epidemiologist, Medical Internist, our Deputy Chief of Police, the media, listening public, Dominicans, good evening. The Contact Tracing and Sampling Committee continues to work tirelessly to ensure that all contacts of confirmed cases are tested once identified. Most times, these activities lead us to contacts of other contacts, which can be a very tedious process. To date, April 3rd, 2020, the committee has investigated approximately 4 index cases with many direct contacts as well as contacts of their contacts. As we speak, 2 of our 3 mobile teams are currently deployed, providing support to the health districts to expedite contact tracing and sampling. Nonetheless, the process of contact tracing can progress most efficiently when these factors are considered. If the client is cooperative with the health team, if the client follows instructions given for quarantine and self-isolation, and if the client can readily provide a list of contacts that may have been exposed within a specified period. So that makes the job easier. However, unfortunately, the process is hampered or becomes more challenging for the committee when the client is not cooperative or if the client is not found. Verbal abuse from clients to Ministry of Health officials when efforts are made to provide information as to the possibility of being a contact. If the client refuses to remain in quarantine upon being informed that he or she may be a potential contact and whilst awaiting test results. Again, if the family is in denial after having a confirmed case and advises against instructions given by the Ministry of Health. Concerns raised by the family and or the client re legitimacy of quarantine and contact tracing. And we've also had instances where the client is cooperative, however, is negatively influenced by family and community members, allowing a shift in being resistant, hence adopting a very uncooperative spirit. The committee therefore sends a strong appeal to families and community members in relation to the following. Please do not ignore your telephone if there is a strange number calling. Do not be verbally abusive when contacted and identified by health officials. Do not discriminate against a community member who you may suspect to have had the virus or have the virus. Avoid taking and circulating videos on social media of clients being picked up by the ambulance. Let's each respect others' privacy. Do not congregate unnecessarily at business places, bakeries, shops, etc., keeping at least a physical distance of 6 feet apart. In so doing, treat every other person, actually, as a potential COVID-19 suspect as it relates to social or physical distancing. And of course, consider it a privilege to be contacted by the Ministry of Health and to be tested if necessary. Sampling kits are not in abundance globally, and therefore, if you are asked to be swabbed, it's because the Ministry of Health is taking proactive measures to protect your health, as well as your family and your community by extension. Now, there is a COVID hotline. As you're aware, the COVID hotline system is manned by a group and subsequently to the primary healthcare team. This is forwarded, to the primary healthcare team. This is spearheaded by the director. As such, the committee has assigned one member of that team for the management and follow-up of clients of the COVID-19 hotline. We wish to commend you, the public, for capitalizing on this resource as it makes it easier to communicate with you, but most importantly, to respond quicker to your health needs. We applaud you for your efforts, and we urge you to continue to utilize this tool rather than self-referral to the health facilities if you are presenting with flu-like symptoms. Nonetheless, it would be remiss of me not to mention the challenges that are being faced based on the misuse of this provision. So for example, we have persons calling for test strips for their glucometers, persons calling for a ride, persons mentioning that their throat is a little tingling, persons with a hangover, persons requesting groceries and Pampers, or, that's an interesting one, the neighbor sneezed or had just one cough. Now, bear in mind, there are definitions of what we call contacts of confirmed cases. It's a specific case definition for COVID-19. So a contact in that case is a person that is involved in any of the following, and there are 3. 1, a person who provides direct care without proper personal protective equipment for confirmed COVID-19 patients. 2, a person who stays in the same close environment of a confirmed COVID-19 client. Or a person who travels together in close proximity with a confirmed client in any kind of conveyance within a 14-day period after the onset of symptoms in the case under consideration. So based on some of these concerns, based on the hotline that is, I wish to inform you of the following guidelines. Besides the COVID hotline, primary healthcare staff are available to attend to your regular health needs, such as your wound care dressings, chronic disease management, emergencies too, maternal and child health services, which includes your regular immunization, child registration, antenatal care, and postnatal care. On-call services continue at all Type 3 facilities at each of the 7 health districts with your medical doctors, family nurse practitioners, and other nurses available to meet your needs. Again, we appeal to you to learn the numbers of the COVID hotline for flu-like symptoms and that of your health district or your district nurse, especially for continued management of your chronic illnesses. Now, just to inform you, we have an appointment system that we just piloted in the Roseau Health District. With half of the country's population of over 36,000 persons in the Roseau Health District, this was selected to pilot, as I said, an appointment system, and that is to cater for the health services of the clients in the district. This came about to mitigate against clients crowding health facilities despite encouragement to promote social distancing. This system was therefore instituted to facilitate prompt patient care and to prevent overcrowding again. So the public is encouraged, those within that district, to call 611-3905 to make appointments between 8 a.m. and 4 p.m. on weekdays, which are Mondays to Fridays. And health centers will remain open to provide for your regular services. Again, I wish to mention some tips, as per usual. We encourage you to stay home and, of course, practice social, physical distancing, and, of course, home quarantine when you are asked to do so. Now is not a time for engaging visitors at home. Again, engage in regular hand washing and try not touching your face. Use your facial mask or some type of facial barrier when in public places, ensuring that your hands are washed before placement as well as before and after removal of the mask. Please remove masks by using the straps or the strings, and again, avoid touching your face. Adopt respiratory etiquette for coughing and sneezing. Frequent cleaning and disinfecting of our homes. When you get home, of course, leave your shoes outside, try to change your clothes, and wipe any articles that you would have brought on the inside. From the outside. Again, sanitize your personal devices. Discontinue the use of the AC and enjoy the fresh air available. Pay attention to your nutrition, hydration, and exercise. By this time, you should have had a family plan, especially if someone gets sick, and of course, adopt frequent temperature checks. Learn the numbers that we've advised, and of course, continue to listen to reliable information from the Ministry of Health. The committee expresses gratitude to the staff, all our staff members, for their dedication, their resilience, commitment, and of course, their sterling contribution to the fight against COVID-19 pandemic. I wish to thank all the committee members, including our clerical staff, also our assigned PS Tourism, so assigned PS for the committee, and I wish to highlight those of our district teams, our district medical officers, various categories of nursing staff, our drivers, community health aides, orderlies, cleaners, domestic workers, environmental health officers, the fire and ambulance officers, as well as the police that are stationed at various districts. We are really in the fight together, and we cannot do it alone. Expressions of gratitude goes out to our kind donors thus far, Mr. Gregor Nassif and staff of Fort Young Hotel and Secret Bay, Mr. Carl Nassif, Robinson Bakery, Benjo Simos, and of course, Miss Mara St. Rose, and those who have assisted her and us in many ways. In conclusion, a gentle nudge is given to embrace the curfew set as an opportunity to enjoy, and I'll list a few, the family bonding time. Let's capitalize on the curfew for that. Take advantage of being with your kids, your spouse, relatives. Read your Bibles. Play, have fun games, laugh, engage in backyard gardening once it's part of your property, of course. Rejuvenate now, Dominicans, so that in the near future you would have renewed strength to face the challenges ahead in our country's recovery. I once more appeal to you to play your part, to enable us to play our part. Please, Dominicans, stay at home for us while we stay outside to protect you. Thank you.
And thank you very much, Dr. Laura Esprit, the Director of Primary Healthcare. I don't think she could have done a better job than she did of reiterating the things that we've been stressing for the longest while, ever since the first onset of this COVID-19 pandemic. So thank you again to Dr. Laura Esprit. Earlier this week, further restrictions were announced by the Attorney General Levi Peter. And this evening, once again, we have with us Lincoln Corbett, the Deputy Chief of Police, who will give further clarification on what is expected of all of us, especially as the weekend approaches. Mr. Corbett.
The Honourable Minister of Health, Wellness and New Health Investment, Dr. Evelyn McIntyre, National Epidemiologist, Dr. Hamid, Medical Internist, Dr. Posh Hamid, Director of Primary Healthcare, Dr. Laura Esprit, PS in the Ministry of Health, Letitia Lesford-Wyke, the viewing and listening public, good evening. On April 1st, 2020, His Excellency the President declared that a state of emergency exists in Dominica, and a curfew was imposed throughout Dominica from 6 p.m. on the 1st of April to the 6 a.m. on the 20th of April 2020. The Command for Dominica Police Force has in place an operation order to enforce the curfew. We have activated the operational plan, and we will use every legal means to ensure and enforce compliance with the SRO within the state, including our territorial waters. These include, among others, arresting and prosecuting offenders, the use of force in accordance with the use of force policy and the Custom Act number 20 of 2010. In furtherance of this plan, all available police officers will be on active duty, and police officers who were on vacation have been recalled to duty. COVID-19 is an infectious disease which poses an imminent threat to the national security of Dominica. We simply cannot afford for this disease to spread and infect our most valuable resource. The Command for Dominica Police Force has been engaged in a number of activities in an effort to enforce the SRO. Some of these measures include foot and mobile patrols throughout the state, patrols at sea, checkpoints island-wide, and surveillance of bays and beaches. We have stepped up our patrols, and while I will not go into operational details, officers from the Marine Unit have been engaged in patrolling our territorial waters alongside members of the Customs and Excise Division because of our serious concern about vessels carrying passengers from the neighboring French islands into Dominica. Our ports are closed. Anyone entering the island of Dominica through a port which is not designated as a port of entry has committed an offense and is engaging in an illegal activity. I therefore want to send a stern warning to the boat owners, captain, crew members, And the people who are partaking, in this criminal activity to desist from this activity immediately. I wish at this time to draw particular attention to Section 135 of Act number 20 of 2010, that is the Customs Act. To summarize, the proper officer may fire on or onto a vessel if the captain fails or refuses to stop after having been signaled to do so. This is a stern warning. Anyone found engaging in that type of activity will face the full brunt of the law. They will be arrested and brought before a court of law. The boats and engines will be kept in police custody as an exhibit. I'm appealing also to bus drivers and taxi drivers to cooperate and adhere to the conditions stipulated in the curfew order. Only one person will be permitted to ride per row on a public service vehicle. No one should ride alongside the driver. The private sector must also adhere to the curfew order as it relates to the opening and closing hours and adopt guidelines to ensure compliance with the order. I'm also appealing to members of the Dominica populace to cooperate with the police and to adhere to curfew order and stay indoors. You must avoid loitering on the streets and in public places. You should only go out on weekdays to access essential services. The coronavirus, COVID-19, is a deadly virus, and the onus is on each one of us to protect ourselves and family from this infectious disease. Let me reiterate that the coronavirus is a deadly disease and an imminent threat to national security. We must take every precautionary measure to minimize the impact of this virus on the country. And again, anyone found violating the curfew order will be dealt with according to law. In closing, I wish to thank the rank and file of the force for stepping up to the call of duty. We are in this battle together, and we will be victorious. Thank you.
And once again, our thanks to the Deputy Chief of Police, Lincoln Corbett. Again, we would like to stress the importance of adhering to the curfew as established by law in the Commonwealth of Dominica. So as of 6 o'clock this evening, the country is on lockdown for the rest of the weekend until 6 a.m. Monday. For those of you just tuning in, just to point out again that Dr. Ahmed presented at the beginning of our briefing 14 confirmed cases now in Dominica. And as we draw to the end of our press briefing this evening, I'd like to call on the head of the Ministry of Health, Wellness and New Health Investment, the one we refer to as our general in this fight, Dr. Irvin McIntyre.
Okay, pleasant good evening to all the listeners. And protocol has already been established, so I'll just continue from here. Fellow Dominicans, you've heard this comprehensive update from the experts in their relevant fields. This is all part of our preparedness plan, keeping you fully informed and giving you regular updates as to our COVID-19 status. I'm very pleased that our frontline staff has taken the challenge and instead created an opportunity for us to show our patriotism in this fight against COVID-19. Our main focus, however, still remains in preventing the transmission of infection. We are fully aware of the symptomatic carrier, the asymptomatic carrier that is, and the possibility for spreading the virus. Case identification activities as we speak are ongoing. For this, we must extend special thanks and full praises to our primary healthcare division and their team of dedicated healthcare workers. Contact tracing exercises has been very extensive and will continue, since our intention is to leave no case unidentified. We must also appreciate the importance of the quarantine measures, both home quarantine and government facility quarantine. Quarantine is an integral part of the fight against COVID-19. Dominica still remains maybe the only Caribbean country providing all quarantine services, including meals and internet, free of charge. In this regard, we are appealing to all persons in quarantine to see their stay in quarantine as their contribution in the fight against COVID-19. Please adhere to the measures given by our healthcare workers. Stay at home, play it safe, and protect our nature isle. Over the past few months, some people have reacted with fear, anxiety, hopelessness, as the situation regarding disease is rapidly evolving. Many people who suffer from pre-existing conditions like diabetes, hypertension, cancers, and respiratory diseases are especially vulnerable at this time due to the compromised immune state. Added to the list of persons who can be considered in this category are persons who use or abuse drugs like alcohol, cigarettes, marijuana, and illegal substances to include crack cocaine and ecstasy. Given the nature of COVID-19, in that it attacks the lungs and upper respiratory tract, this virus can be a serious threat to those who smoke or practice vaping. There are many persons who have and will in time resort to the use of alcohol as a coping mechanism for stress, anxiety, or to cheer themselves up. However, drinking to cope with these feelings is likely to have the opposite effect. Downing too much alcohol could also reduce your immune system's ability to fight off infectious diseases. The Ministry of Health is calling on the public, especially bartenders, to adhere to and follow the stipulations and guidelines stated by the government of Dominica in regards to closure of bars and the suspension of liquor licenses. Although we are currently in a period of social distances, there are various means to connect with family and friends that can reduce stress and anxiety levels. These include good old-fashioned conversations, use of social media platforms or Zoom to catch up with friends and family members, take online classes or learn a new skill, host virtual events, prepare your family emergency plan, home gardening, yard cleaning. We must also continue to practice hand washing etiquette with soap and water or alcohol-based sanitizers. Cover your nose and mouth with a disposable tissue or flex elbow when you cough or sneeze. Stay home and self-isolate from others in the household if you feel unwell, and contact the healthcare providers or call the hotline. And please wear your masks. We must remember that in order to stop the spread of COVID-19, each citizen must play their part. Before I leave, I must say our country remains very grateful to the friendly governments who have demonstrated that the friend in need is a friend indeed. We must make special reference to the government of the Republic of Cuba for providing us with medical personnel, the government of the People's Republic of China for providing medical personnel and supplies, and also to PAHO. As a matter of fact, yesterday, the RSS brought in flights of supplies from PAHO. These included our testing kits. And today, another flight came in with supplies from the People's Republic of China, Both of these were cargo flights and not passenger flights, and all protocols were maintained. I would also like to extend our deepest thanks to the local firms who have assisted us in one way or the other. These are Springfield Trading Limited, HHV Research and Company Limited, Dominica Brewery and Beverages Limited, Cots Dominica Limited, Fort Young Hotel, Secret Bay, Tranquility Beach Resort, Robinson's Bakery, and Benjo Simos. Let me also take this opportunity once again to thank all stakeholders involved in our fight against COVID-19, including Environmental Health Department, Customs and Excise Division, Immigration Department, the Dominica Police Force, DASPA, Ministry of Agriculture, Office of Disaster Management, Dominica Fire Ambulance Services, Health Promotion Unit, Primary Healthcare Division, staff at the Dominica China Friendship Hospital and St. James COVID Hospital in Portsmouth, including ward aides, orderlies, nurses, doctors, and the staff of the medical laboratory, radiological department, and pharmacy. All permanent secretaries in the ministries, staff of Rapid Response Unit, all hotline volunteers, drivers, and construction workers retrofitting the Portsmouth facility. We must remember that in order to stop the spread of COVID-19, each citizen must play their part. I thank you, and may God bless us all.
And thank you very much to the Honorable Dr. Irving McIntyre, the Minister for Health, Wellness, and New Health Investment. And that takes us to the end of this evening's press briefing. But before we say good evening, I would like to stress once again the importance of practicing social distancing. Every time you tune into a press briefing, ask yourself, what am I doing to help curb the spread of COVID-19? What part am I playing? Yes, you listen to the Ministry of Health. Yes, you listen to the government. But what is your role? And are you performing your role to the best of your ability? You are primarily responsible for your own health. We at the Health Promotion Unit say that your health is your responsibility because we will do whatever it takes to protect you, but it is up to you to do what it takes to protect yourself. We're asking that you use your masks properly. It's not just about placing it on your face. Are you wearing it properly? The curfew, we're asking that you adhere to. Hand hygiene, respiratory etiquette, cleaning of surfaces. We have been promoting these things from the get-go. We also stress the importance of getting your information from reliable sources. We do these press briefings just so you will have valid information. We also ask you, as Dr. Esprit said earlier, not to abuse the hotline. The operators have been volunteering their time and service. They have been spending a lot of time away from their family. So we're asking that you not abuse the hotline. The numbers for the hotline, if you need to contact, are 448-2181, 448-2153, 448-2156, 611-4325, and 1-800-219. I must say it's very heartwarming when we see so many individuals and businesses come on board to assist. And Dr. McIntyre and Dr. Esprit both expressed their gratitude, but I too would like to extend my gratitude to the private sector and the individuals who have said, I want to help, tell me how I can do so. So thank you to all of them. And I want to thank the general public who has been so cooperative thus far, patient and exemplary when asked to do what it takes to ensure public safety. And for those who have not, it is time for you to start doing so. Thank you again for listening. Have a good evening.